Samsung, proud sponsor of TechBusters.
We're at the Urology Hospital in Pretoria for a first in South Africa. We're here for the launch, as what you can see behind me. This is the Vinci Robotic Surgical System, and it's one of very few machines of its kind that have been launched around the world to perform operations on things like the prostate, when you want to remove a prostate, and it's non-invasive surgery using robotic arms. It's absolutely fascinating. Join me as we find out more about the Da Vinci machine.
The Da Vinci is a new multi-million rand robotic surgery system which undertakes highly complex surgical procedures safer and more cost-effectively. The robotic technology is used in major medical centers all over the world and is ideal for both complex and delicate surgeries, like the removal of the prostate, which is exactly why the Urology Hospital in Pretoria invested the time and money to get one.
So I'm here with Thomas Dunbar, who's the Managing Director of Earth Medical. This is the company that's bringing the Da Vinci Robotic Surgery system into the country. Well, firstly, congratulations. I think this is a huge moment for South Africa. So where was this machine born? I mean, who thought about making a machine like this and designing such a complicated robotic machine that's going to be doing all the surgery?
Okay, it's in fact, if one looked at where Da Vinci, the name comes from, it came from Leonardo da Vinci. He first drew a first robot. So that's where the name Da Vinci comes from. And no, it's not complicated at all. Laparoscopic or minimal invasive surgery is almost 100 years old. So this is not new for surgery. But normally what would happen is a doctor would use a laparoscopic instrument or instrumentation. Everything he's doing is counterintuitive on the camera. So when he's looking and doing surgery and looking on the camera, everything he performs is opposite. So he has to learn opposite. With Da Vinci, this is why it's called intuitive surgical. Because everything the surgeon does, if he moves his hand to the right, the instrument moves right. So it's intuitive in the way it operates.
The system allows procedures to be completed with less blood loss, less pain, shorter hospital stays, and a quicker return to normal daily activities, and could hopefully see South African surgeons taking minimally invasive surgery to the next level.
We are with one of the world's top urologists, Dr. Lance Casilla, who is kind of responsible for bringing it into the country and will be one of the doctors to be conducting one of the first operations. Now, Dr. Lance Casilla, how is this going to change your life? What is this going to do to surgical procedures in the field of urology?
The time of the surgery is more or less the same and may even be a little longer than what we're doing with open surgery at the moment. But certainly the morbidity to the patient in terms of blood loss and the dangerous aspects of big cancer surgery are far easier to control. And that's where the patients really will benefit.
And the recovery, of course.
The recovery is less than half of the time, yeah.
Has it been a difficult transition for you to make from using your hands to now trusting a machine that's doing the work that you used to do?
Well, the interesting thing is, the robot still responds to what you tell it to do. So the robot doesn't make a bad surgeon a good surgeon. And that's an important concept, really. But the transition has been a lot easier than one would think because everything is very intuitive. The whole basis of the technology is the so-called endo wrist on the instrument, which can turn 540 degrees. So the wrist can actually turn more than your own wrist can. And that's what makes it so amazing, because you can get in behind organs and move things out of the way and, far more. So you actually see better than you do with your normal eye.
Are there plans to roll out further machines like this across the country?
Yes, Aki, there are. But as we would like to have it, we would like to have centers of excellence, such as the Urology Hospital here, where surgeons could come and do the robotic surgery here at a hospital like Urology Hospital, but not have a snowball effect of robots all over the country. Because our drive is to drive the clinical pathway, to drive trained surgeons. So rather have few highly qualified robotic surgeons that do the surgery very, very well, but do very high volumes of it, than have surgeons that are doing low volume surgery and intermittent.
Well, as you can see in the background, the doctor is sitting in another room operating on a patient, and what you're seeing over here is magnified by 10 times in the doctor's eyes. And these robotic arms are doing all of the work with a great deal of precision. This is the Da Vinci surgical system. One of 3,000 robots like this of its kind around the world, the first one in South Africa at a cost of 17 million rand. This is the future of surgery. It's all about robotics.